3 skincare products you must not use while you're pregnant.
Just watch me now. Just watch me. Just watch me.
Welcome back to my YouTube channel. I'm Nurse Sarah Louise, and I'm going to show you my skincare routine while I am pregnant. What I need to show you first is what I cannot use. So as you guys know, I am a firm advocate for medical grade skincare. However, you can no longer use a salicylic acid based toner that is going to enter into the bloodstream. And this is poor therapy, and I no longer can use this. My next treatment that I can't use is my prescriptive vitamin A. If everyone knows the golden treatment of tretinoin, anti-aging, wrinkle combater, Botox in a bottle, unfortunately, it's a no-no while you're pregnant. The third one I can't use is my skin whitening or bleacher. We also know it's a prescriptive item and it does go into the bloodstream. So what can I use? Let me show you my exact routine while I am pregnant. I use a really calming cleanser to begin with, take my makeup off and do a double cleanse. The reason I do this is because you can sometimes be a little bit more reactive and sensitive while you're pregnant. The other that I cannot live without in my AM routine is my changed exfoliator. So I've substituted the prescription range and I've brought in a non-prescription range, both salicylic acid. However, this one doesn't penetrate into the bloodstream, and this will still exfoliate my skin on a daily level, control my pores, my oil, and any breakouts. And when you're pregnant, hormonally, you can have some damn breakouts. So this bad boy is something I really don't want to give up. Other thing in my AM routine that I will never stop is my vitamin C. It is one of the very few active products I use, but this will keep my skin really bright. I always talk about bright, 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 and I don't want to give this up, and I love it. It's really hydrating, and it really can control some pigmentation while you're pregnant as well. The last but not least in my AM routine is SPF. Obviously, you can continue to use this while you're pregnant. I would advise you to use this while you're pregnant. The reason being, you can be more photosensitive, you're more at risk of sun damage, of getting melasma, pigmentation, and all of this is driven by your increased hormones. So this guy, you cannot give up, you must continue. Nighttime routine, the only thing that I change in this, I still obviously have my cleanser, but I keep it really basic. I don't have any vitamin A's, and I go straight in for a calming moisturizer. You don't want anything that's too heavy or too irritable. So this one is really nice. I favor the Illumia brand for that. And I would encourage you to always choose something light because of the oiliness that you can wake up with in the morning after being pregnant. I don't know about anyone that's pregnant, but you get super hot, super clammy, and a bit sweaty. So always choose something that is really lightweight. So guys, just be really careful when you're pregnant or you're trying to use skincare. If you're confused, seek a skincare consultant. They will be able to advise you on the best possible treatments. You can drop a comment. I can actually have a little look for you and see if it might be appropriate. But the biggest thing is always stay away from prescriptive skincare because we know that these haven't been tried and tested on pregnant women. We obviously say absolutely no. Stay clear, try and get most of your high street brands or still seek medical. Just go for a range that's a little bit more cosmeceutical and a little bit more nurturing to the skin. So guys, thanks for watching again and tuning in. Don't forget to like and subscribe because obviously you'll get triggered when I have another video coming up. If you have any questions, if you're unsure, pop a comment in the box and I'll be sure to get back to you on the appropriateness of the product.
Just watch me now. Just watch me.